So your inhalers have changed because recently the national guidelines were updated, where the British Thoracic Society, Asthma Lung UK, NICE, who are the governing body for guidelines, and the Scottish Intercollegiate Society as well, felt that it is better for us to give patients a combined inhaler that puts both your inhaled steroid and a reliever, which is the blue one that as you know it, together to enhance the treatment that you get for asthma, because everybody responds to asthma differently. But this has been found to be the best way and to improve asthma care in the UK, because we are one of the worst for asthma deaths. And one of the main reasons is we want to stop that from happening and to improve the lifestyle that you have and to improve your lung function and to improve your general well being. So we are upgrading your inhaler because we want to give you better care and improve your symptoms. And that means the therapy and the evidence has suggested that having a combined inhaler. So if you're using it like for this one, you're using it as your maintenance and reliever therapy. So that's the meaning of MART. It means that you have one inhaler that you use on a daily basis, but with the same inhaler, you're able to carry around and use when you need it, if needed, if you had symptoms outside of when you've used it as your on a regular basis. So just like how you would use your separate brown and your separate blue inhaler, now you've got one inhaler to do both. It means it's much more flexible for you. It's less in terms of cost because you only pay, if you do pay for prescriptions, it's just one inhaler you have to pay for. And ultimately, it will improve your asthma symptoms as well. You might be feeling worried again about not being used to carrying your blue inhaler, but in actual fact, if you think about it, what is the point of carrying something that could end up doing more harm than good? So again, it will take time. We completely understand that it's something that it's a cycle that we need to break. But we will just encourage you to keep persisting with the new change, and eventually it will get better. So in summary, inhalers have changed, or I would say let's call it the treatment of asthma and management of asthma has changed because the national guidelines have been updated and improved. Because we want to improve and reduce the risk of you having an exacerbation. Because we also want to make it more flexible for you that instead of having two separate inhalers where you're trying to figure out which one am I meant to be using, you now have one inhaler which does both, or whichever way you use it. Like I said, you're either using it as a reliever or you're using the same inhaler as a maintenance as well. And ultimately, it's to make sure that you're much better, you're more improved. Your asthma symptoms are not causing you to have a less quality lifestyle, but actually to make things much better in the long run.